I will call to order the Personnel Policy Curriculum Committee meeting, which was duly noticed on January 30th, 2026, through posting and notification of the press in accordance with Wisconsin 19.84. Notice is hereby given that school board members who are not members of this committee may attend this meeting so as to constitute a quorum of the Board of Education. Any such board member attendance will be for information gathering only and will not result in direct decision-making by the Board of Education at the committee meeting. I need to pull up my safety message. I'm sorry that I didn't already have that up, so. Okay, just a few little safe winter driving tips because unfortunately we still are in winter. We still have, I guess, 6 weeks left, right, everyone? Winter driving often means traveling on snowy, icy, or slushy roads. Ensure that your vehicle's tires are in good condition. If your area regulates snow tires or chains, follow those regulations. I don't really know anyone that uses those. Thankfully, we don't really need that. Remember that it will take your vehicle a longer distance to stop on slippery roads. Communicate with your family or coworkers if you are going on an errand during bad weather. That way, if something should happen, like you skid off the road or break down, people know to start looking for you. Keep cold weather supplies in your vehicle in case you do get stranded. Pack a bottle of water, snacks, a hat, extra pair of gloves, and a small snow shovel. Those are my winter safety tips for you. And I just have to say, we made it to the February meeting. The last 2 years, our February meetings were canceled because of one emergency or another, and we have officially made it through that curse. So I'm excited. We've done it. We've made it through. I need a motion to adopt the February 2nd, 2026 agenda as presented.
So moved. Second.
All in favor? Aye. That motion passes. Moving on to 1.4, Act 20 screening process, Dr. Allison DeGraff.
That again. Good afternoon. We are in our second year of the Act 20 statewide literacy assessments. In previous PPC presentations around Act 20, we've shared information more about the state requirements and how our district is in compliance with those requirements. Today's Act 20 presentation focuses more on what does it look like on the teacher and student side of administering and the student taking the assessments. So just a quick, very brief overview on Act 20. So I know we're familiar with it, but again, it's just a reminder that Act 20 is that state law that requires all public and private schools to instruct 4K to 3rd grade students in science-aligned literacy instruction to help students achieve reading proficiency by 4th grade. So why did they create this law around science-aligned reading instruction during the 22-23 school year? They had fewer than 39% of Wisconsin students that were proficient in reading, and so as a result of that, they enacted this legislation. So with that Act 20 passing, then now that's where we're required to have a common diagnostic assessment for our 4K through 3rd grade students. So every student is taking the same assessment across the state during a fall, winter, and spring window. And any student that falls below the 25th percentile on these assessments is required to have a personalized reading plan. This year, because we're in our second year of Act 20, any 3rd grader that was not dismissed from their reading plan in 3rd grade and was not proficient on forward remains on a reading plan in 4th grade and receives support as well. As we look at the statewide literacy assessment, Ames Web Plus is the statewide literacy assessment that we use. The company is Pearson, but all schools across the state use the Ames Web Plus assessment. It assesses students in these categories that are, or these specific reading areas that are aligned to the science of reading. So any subtest they take will either be about letter sound knowledge, oral vocabulary, decoding. So every subtest fits into one of these science-aligned reading areas. So let's look a little bit about what do the assessments look like at each grade level. So 4K, we don't put students on a reading plan in 4K, but we do assess them. So they are not assessed in the winter, they're only assessed in the fall and the spring. And so they look at initial sounds and letters. And so that number, for example, when we look at kindergarten, they have multiple subtests. But in kindergarten, they have a composite score that determines whether they're on a reading plan. And so that composite score is only letter naming fluency and letter word sound fluency. So they take all of these other assessments, but that's just to provide the teacher information on areas to continue to provide instruction in. But the two subtests that I shared are what they combine the score to get a composite to determine if they go on a reading plan. The numbers after them, for example, is the cut score. So, for example, letter naming fluency by winter of kindergarten, I need to know, if I know less than 26 letters, then I would be possibly on a reading plan. So that number next to each of the subtests reflects what that cut score is. If they're below that cut score, they're on a reading plan. So now let's look at each grade level as well as what does that assessment look like on the teacher and student side. So as you can see, do you remember way back in kindergarten when we would practice our letters and draw them in shaving cream? So to continue to practice learning those letters and sounds. But so what that looks like is they have to follow the, all right, so 4K, they have to say each sound and it goes in columns. And then they also have to say the letters, and I'll show you what that looks like in a minute too. But they say they recognize the letter and they have 1 minute to recognize as many sounds or letters as they can. Then also when they look at initial sounds on that assessment, they will ask the student, they'll see 4 pictures. So this is not the actual assessment, obviously this is examples. They will say, find or point to a picture that, or 2 pictures that start with a k sound. So they have to find the picture that shows that initial sound. And then when you look at kindergarten, they assess the sounds and also the letters as well. And on the assessment, you can see they don't give you all uppercase or lowercase, they combine them. And again, they have to read as many as they can for 1 minute. And if they don't meet that cut score, then that indicates they need to be on a reading plan. You'll also see too, and I'll talk about in first grade, that's where they have to start to read nonsense words to see if they're applying those decoding skills. Now when a teacher, so that sheet would be in front of a student and a teacher would be pointing to each letter. If the student doesn't know the letter, they give them about 2 to 3 seconds and then they move on because they don't want a student to spend 30 seconds on one letter and then don't have an opportunity if they maybe know some other letters in that progression. So there is very explicit directions for the teacher in how to assess the student so that it's standardized. So then in first grade, at the beginning of the year, they have more subtests because they're looking still at some of those foundational skills that they might still be focusing on at the beginning of the year from kindergarten to first grade. But by the winter of first grade and the spring, they have to do an oral reading fluency assessment. And so, and actually that winter should say 18, but spring they have to read at least 26 words per minute or they will be specifically on a reading plan. First grade does combine 3 tests for their composite, which is word reading fluency, nonsense words, and oral reading fluency. So when we look at what those look like, these are kind of the 3 subtests that are combined to give a composite to say whether the student is below the 25th percentile. So they have to meet the cut score on reading those nonsense words to see if they're applying decoding skills. Then you can see what we call high-frequency words. They're also timed on that. How many high-frequency words can they read in a minute? And then they're asked to read this passage, and they have to read 18 in the winter, and 26 words is that cut score. Now, they might read more words than that in 1 minute, but if it's less than 26 in the spring, they would be considered on a reading plan if those other two subtests combined also indicate that. So it is, the challenging thing is first grade, they're still learning to read. So fluency is one of those things that kind of comes after you're a little stronger with decoding, but it is part of the assessments that is considered for first grade as well. So in first grade and second and third, they also assess vocabulary, grade level vocabulary. In first grade, that vocabulary assessment is, I give you a grade level vocabulary word, you have 4 pictures in front of you, and you pick the word that matches what I say to see if they're understanding grade level vocabulary. When you get into second and third grade, again, this is not part of their composite score, only the oral reading fluency is to determine if they're on a reading plan. But the vocabulary assessment at second and third, I'm a student, I'm sitting on a computer with headphones, they're reading me a grade level appropriate word, and I'm picking the correct definition. So this assessment is just to inform us how well are students doing on their grade level vocabulary, but it's not part of determining whether they're on a reading plan. So then you can see the cut scores for second and third grade as we move into fall, winter, and spring. And so you can notice a student may not be on a reading plan in the winter because they can read more than 45 words per minute. But if I don't progress, by spring I could be on a reading plan if I don't get to 60. So the cut scores change because they're expecting students to continue to grow, which makes sense, but it can mean that a student might not be on a plan at the beginning of the year, but they may be at the end of the year if they're not showing, which that tells us they're not growing at the rate we are hoping as well too. Sure.
As long as you're right here, why would oral reading fluency for second grade fall be lower than first grade spring?
That's a good question. The text becomes a little more complex, so it's a harder text. So although it's, the words per minute are less, it's just that it's harder text. Yep, but good question. So here's what a second grade text looks like that they have to read in 1 minute. And then again, as I was sharing with you, Commissioner Hayworth, we have a longer text to read as well with more complex vocabulary. So that assessment and all of the assessments in 4K through 3 are administered one-on-one by the teacher. So that does take time. So one of the things as a district that we have done is we've offered to provide the teachers a sub so that instruction can continue because they have to pull students out one at a time. We also have our title teachers, EL, other teachers helping as much as we can, but we don't want instruction, just stopping for a couple days to complete this as best we can. So we do provide that as a district for teachers if they would like to use that.
While you're on that topic, so the teacher is doing the assessment for, like, if I was a third grade teacher and I had 25 kids, I'm doing all 25 of my kids outside while you provide a sub. How long does that take? Is that like a 2-day sub type of thing, or how many?
Right, and so between the combination maybe of a sub and like the Title I teacher or reading specialist is helping, it takes at least a full day. I mean, it's timed 1 minute, but you still have to pull the student out, you have to provide direction, so, each student is probably at least 6 to 10 minutes depending on the student.
I do like the fact that every student gets their classroom teacher for consistency purposes, and that's just not another variable that, why one student might succeed because they have a different relationship with another person. So I do like that. Thank you.
And a lot of times if it's the title or reading specialist, they're the ones that have been working with them too. What I also will say, they do test all students. So whether you're special education, EL, Regular ed, every student is assessed. So even though they already may have a specific, even if they're already identified in the area of reading, they are still required to take this state assessment and still show progress as well. So Kim has worked closely with the special education staff to provide guidance on what those, on supporting students during those assessments as well. I will say that we have found that our teachers have done an excellent job of identifying our students. We really have not found a student that we were not already supporting. So whether that was supporting within the classroom in a small group or pulling them out for instruction or already identified in a specific area, very limited. So I guess I just want to, really say I appreciate our teachers and how effectively they provide reading and instruction and understand where each of their students are at. So what are some of our next steps? So just a little, we talked about the state was saying 39% of our students were reading proficiently. Our spring combined K-3 overall, we were at about 44% of our students on a reading plan combined. Rock County was 50%. So we are below that Rock County average. Now, the cut scores have changed. So right now, our average is more around 26% of students on a reading plan because the cut scores changed. So similar to what you saw on Forward. So we can't do a spring to spring comparison this year because the cut scores changed. At the state level, so.
And what's in here is the current?
This was last year, so,
These are last year's
Yep.
numbers in here.
so it'll look, our numbers will be lower this year, but it's not, hopefully we've improved, but it's not just that, it's that. Correct. So I just wanted, if you ever see data, I wanted you to know why that's going to look very different. We do know on our state accountability test that the state average for third grade reading was 50% of the students reading proficiently, and in Janesville it was 60% of our third graders are reading proficiently. So we are significantly higher than the state average in third grade reading this year on our state assessment. So as we look at next steps, and what are some things that we're doing to continue to support our students in continuing to hopefully move them, students that are below that 25th percentile, to move them above the 25th percentile. This year we did a series of 3, we'll have our third one in April, professional development around fluency. So our teachers have received professional development in that area. And some of the tools that we've used too, you'll see the picture of the book, the High Leverage Instructional Routines Toolkit, our CISA put out. They specifically have a section on fluency strategies. So we've used that resource as well as the book Shifting the Balance, which is science-aligned reading instruction, and pulled fluency strategies out of there. And we shared those out in a professional development, and so then the teachers, the first professional development, we shared the strategies with them, then they went and tried them, and they brought them back and shared how they worked. And then we have teachers that have excellent strategies of their own, so we also gave them an opportunity to share the strategies they've developed in their classroom and are using with students, so that, as colleagues, they are supporting each other in building that fluency instruction. We do also provide students practice, especially in 1st through 3rd grade, of giving them a grade level passage and reading for 1 minute. So we continue to see if they'll, try to make sure that we're helping them progress to that, above that cut score by the spring assessment. Many of you are familiar with word walls. We've really shifted to sound walls. So as we introduce sound, so many times previously you would have walked into a classroom and saw lots of high frequency words. Now you'll see sound walls. So every time we introduce a blend or a medial vowel sound or a digraph, that's going to be put up on the sound wall. So as they're decoding, they can reference what phonics instruction that they've had to help them sound out a word. Now you still might see some words or word walls as well too, but all elementary students, especially K-3, have a sound wall. We also did Shifting the Balance, which is more focused on 3 through 5 instruction with fluency that we've offered book studies on this year as well. And we've pulled strategies out from there to introduce to all staff. We had all staff read the K2 Shifting the Balance because similar to the philosophy of our statewide assessment that we required K5, we wanted 3-5 teachers to have those K2 strategies because they have students reading below grade level. So again, a lot of training around that fluency practice. And then one thing I also wanted to mention is Act 20 is really, especially in first through third, around building fluency. Balanced instruction also includes decoding, fluency, vocabulary development, and comprehension. So there's been conversations over the years around whole language and phonics instruction or balanced literacy and science-based reading instruction. And if our kids only learn how to read quickly, then they're not a balanced reader. So it's really important to try to remember we are working on decoding and fluency, but in order to be a well-rounded reader, we need specific strategies and how do I understand text around comprehension and how do I build grade level vocabulary. So a lot of times we gotta stay balanced in what we're teaching so that our students have all of those skills that they need to be proficient readers. So I just thought I'd put that plug in as well for understanding that. And you will hear teachers say as well, sometimes, when I'm assessing a kindergartner and were identified to be on a reading plan, but part of it was they know their letters and sounds, but they can't say them that fast. Or the same with the first grader. And so when you're trying to teach a student to decode and you tell them to take their time to stretch the word out, then they don't reach the words per minute, but we're definitely see that they can read a grade level passage. So those are a little bit of the challenges and struggles teachers have, because of course they want to, continue to help their families and students understand that they are being successful. It's just right now we have to work at getting a little faster, but you are on the right path. So it's kind of a overview of everything that's been happening from the teacher and student lens for Act 20 assessments. So can take a minute if you have any other questions.
I did like to hear the whole balanced approach, because I think that's important, but it took me back to a conversation when I was a third grade teacher with a parent, because the scores went down for this little gentleman to be below, but I said, he reads fine. It was just, he was a poor test taker.
Mm-hmm.
So you have to understand that as a classroom teacher, that, you are asking those children to stretch out those words and take their time, but then you put them in a situation, thank you, state of Wisconsin, where they have to be tested and timed. And some students don't do well in those test-taking things. So I appreciate that comment, because I was like, oh, I had that conversation, and I had to calm the parents down, because they were really, didn't think their little boy was reading. I said, he reads just fine. He's just not a good test taker. I see him in science and social studies. So I appreciate that comment. And my other question was, I guess a comment and a question. On that first page about Act 20, you said it's a Wisconsin law that requires all Wisconsin public schools and private institutions, so that's parochial schools too, correct? To instruct 4K to third grade students in science-aligned literacy, and all public school levels. So does that mean private schools don't have to assess their reading levels to reach proficiency, and that's only on the public side? I saw a split there because I didn't see that. So
Yeah,
could you
that's a good
maybe
question.
explain that?
I can follow up to check. That's information that was provided from DPI too, so they do have to provide instruction. I'm not sure if they have to use the same statewide assessment, so they may assess similar to, they may not have to use forward like they do, but they have other assessments that they're still,
I was just curious about
Yeah,
that,
but-
because I saw that fall off in the
Yeah,
latter half of the definition.
yes, so, yeah.
As a quick question, summer slide I know is the thing, right? It's real. So if a student leaves in the fall, the spring, and then they roll into this fall semester with this reading program if they're not making okay. And how how big are we seeing a drop again in the fall? Like, how big is the summer slide are we seeing with this test? Maybe it's too early to tell that yet, but I'm just curious.
Sure. So to add, one of the things that's also required from Act 20 that we've maybe talked about previously, I didn't mention today, is we are required to invite all students on a reading plan to summer school and provide reading instruction related to their reading plan. So, and we have to start providing that for fourth grade starting this year. So we have to invite them. It does not mean that we can't make it required, but, so we did invite every student on a reading plan to summer school to receive reading instruction. We do still see some summer slide, but I guess I would have to look specifically at numbers, but yes, we do tend to see sometimes like a 10 to 15% slide in the fall. Usually we start to recover in winter, once they've been in school for a while, but yeah, it is, and I think that's part of also the requirement and what we try to do with summer school is trying to help. Summer school doesn't always necessarily, you don't see a lot of progress, but if we can do anything to just maintain where they were when they left is really one of our goals, so. Yeah. I would say about, I would say about a fourth of the students. I'd have to look at exact numbers, but based on our enrollment in those classes, we struggled to get enrollment, and so we tried to do letters and reaching out and things like that too as well. But people have busy schedules and things happening in the summer, so, I understand some of that as well, and they may be doing other things at home, but we do offer it, so. Mhm.
Next question.
Of course.
I was listening, thank you for very thorough. Could you briefly explain, maybe for our audience, the difference between the Act 20% who are on a reading plan versus the percent proficient in full? Because I think there's an opposite piece. I just want to make sure that, so for example, which ones do we want higher and which ones do we want lower? If that makes sense.
We want lower the percentage of kids on a reading plan and higher, so.
So then could you reiterate the scores you talked about before? Because I think you did it right. I just want to make sure
Sure.
you understand what you're communicating.
Sure. So we have 60% of our students on the state accountability assessment that says 60% of our third graders are reading on grade level. When I talked about the composite of overall, I had the 42% that were on a reading plan. So now if I look just at fourth grade, it exactly aligns with what we found on Forward, because 40% of our third graders are on a reading plan, so that would mean 60% are considered proficient on the Forward. So again, our goal is to reduce that number that's on a reading plan. So we want 40% to be smaller, and we want the percent of kids proficient to be higher.
And so when they changed the cut scores, did they make it easier, more kids on a reading plan or less kids on a reading plan?
Less.
That makes sense. They changed the cut score so less kids are identified.
So instead of like knowing what 26 letters look like, they put it down to 18. We're good with 18 instead of 26.
I don't know what the test.
Yeah, whatever, however, but yes, that would be an example of how they might.
I'm guessing that change came because when it was first implemented, it was too strict and not in alignment with the general progression of student skill level during their reading development process. So, and I think also that there were some other restrictions that related to summer school, like there were things that initially in Act 20 that students were going to be retained and they were going to be mandated to be in summer school, and it sounds like they have gotten a little more flexible with some of those things, which I'm glad to know. I was going to ask about summer school too, so it's be interesting to see, as it continues, what happens for our students. But I mean, to see that 39% only proficient across the state, and then to hear about our third graders reading at 60% reading at proficiency, I mean, clearly the work that your department and our district and all of our dedicated teachers and staff have put in have made some big, big impact in our learners, and that's a huge point to celebrate for sure. So I'm excited to see, you know, in another year where we are. I particularly appreciate this presentation. It was a, you know, a really different lens than what we've seen before, because we've heard about all these different parts. And I think it's great for you, Lisa, as you're, you know, in the re-election cycle to really see this up close data on the amazing work that is being done and the efforts of our students and the progress that we're making. So kudos to everyone. Thank you. Any other questions? All right, we are moving on to, thank you, early entrance to kindergarten, but you're not off the hook, Dr.
I'll
DeGraff.
just stay right up here. So you received the memo on the policy related to early entrance, and so this is about making a revision to this policy. And really, the revision to the policy is specifically under the early admission section, so just one small section of the policy. And so what is our rationale for wanting to consider to change that policy or make that adjustment? So we have been finding that we are assessing, you know, in kind of spring and summertime, we're assessing students to see that have like a September 1st cutoff birthday for early entrance. And we've been finding we're assessing a lot of students, but very minimal qualify. So when we looked at that around the past 10 years, we've evaluated 27 students and one has qualified. So, and some of the feedback we've had from parents is sometimes they're also, one of their considerations is about childcare as well, and that's a feedback from parents when we've met with them. But with only one meeting the criteria over the last 10 years, and we do a comprehensive assessment that really looks at their intellectual ability, emotional and fine gross and motor skills as well. So we also reached out to other districts to find out, do they have the policy, do they not have the policy? We had some of both. So it wasn't a clear cut, we all are, or we're all not. We have some that do not have an early entrance, and we have some that still do. So when we think about the revision of the policy, one thing I want to clarify as well too, so this does not mean when a student enters kindergarten that they can't be accelerated. So what this means is they wouldn't necessarily qualify for early entrance to kindergarten. It's been such a minimal number in 10 years. But what we do, for example, even, I believe it was even last year, we had a student, when they enter kindergarten, if they seem to be significantly kind of exceeding grade level expectations, then we will have an evaluation completed. Either it might be the teachers may recognize that right away, or a parent may come in asking that question. And so, for example, we had that situation with the kindergartner, and we did move them to first grade. So a student can still be accelerated. It's just, it wouldn't happen prior to kindergarten. And sometimes what's nice is the student is there and you actually get to see the student in the school setting and how they're performing and able to make kind of a better decision. Is this a student that we feel we need to assess for acceleration? So we will still continue to assess students if we feel they need to be accelerated. It's just changing it so we're not doing it right at the prior to kindergarten. So that is our kind of rationale. And so the revision that we're asking is that the policy would just explicitly state that we don't allow early entrance to 4-year-old, 5-year-old, and first grade. But that we will assess them when they come into school if we feel or determine that they need to be accelerated.
Do I have to make a motion?
We're not there yet.
Okay.
I think it's looped in.
I think it's with
looped
one
in.
other policy.
It's in the next, like in 1.6, so you can do that then. And I just want to clarify, there is a cost involved for all of these screenings that the district has to cover, right?
Yes, so we do, Yes, because it's beyond their workday, or if they're coming in the summer to do these assessments. So yes, we're paying a team to come in and do the assessments and write the evaluations and meet with the families to explain them, so.
Thank you for clarifying that. Okay, we appreciate the update.
Thank you.
Yes, moving on to, well, now the review Neola policy revision and consider moving to full board for adoption. There were two policies, the emergency nursing services policy, and then the one we just discussed, the early entrance to kindergarten policy. I need a motion to pass those to the full board.
Second.
Any questions about either of these? All in favor? Aye. That motion passes unanimously. And then finally, I guess not finally, but next, we have 1.7, benefits update with Jamie Brown.
Good evening, everybody. Tonight, I am here to provide you with a benefits overview. A lot of this information you are aware of, so will just be a friendly reminder. We will talk about how the plans were ran and utilized last year. We'll talk about our current renewal status and then the long-term strategy. For the fiscal year 24-25, just as a quick reminder, our plan years run from July 1 through June 30th. Mercy reported a medical loss ratio of 129%, meaning that for every dollar that the district paid Mercy in premium, they were paying out $1.29 in care. The district paid Mercy $11.6 million in premiums. Mercy's spend was $16.6 million. When that number does include their medical and their pharmacy spend combined. Their pharmacy costs were 13.5% of their entire $16 million, and that's a normal range. So I would say that Mercy's right in there. Dean reported a medical loss ratio of 131%. We paid them $3.6 million in premium, and they paid out $4.8 million in claims. You can see here that Dean's pharmacy spend is a little bit higher than Mercy's, and that is because there are certain medications that Dean has elected to include in their preventative care that does not require employees to pay any portion of it, so they are covered in full by Dean themselves. An example of that would be a blood thinner medication, and there are some diabetic meds out there as well. So renewal is just around the corner. As a brief overview, the district's spend in health insurance is approximately $15.4 million. We paid $12.1 for the district's portion of the health insurance. Our, excuse me, Family Advantage Health Plan is about approximately 1.1. Our active HSA contribution is $1.2 million. And our retiree health and HSA budget is $1 million. So as we go into renewal status, we did receive confirmation that Dean will not renew their contract with the School District of Janesville effective July 1st of 2026. There is a required 20% enrollment threshold that we are required to meet. This is our second year of not meeting that requirement. Excuse me. One of Dean's proposals was that the district were to adjust how we pay the contribution. So right now, the district pays 88% of the lowest cost plan. So we have 4 tiers, so between single, employee children, employee spouse, and family. I would say about 7 years ago, we would go back and forth between which one was the lowest cost. That has now shifted to being Dean carrying the highest cost plan. So the district is not in a financial place to adjust our defined contribution. We would be looking at approximately $1.2 to $1.5 million increase on that 15.4 million if we would do so. With that, we've started to have conversations with Mercy Care. Now that they will be our sole provider, we will have a not to exceed of 14.5%. So when I talk with Dan and let him know about the budget, we are budgeting in 14.5 this year. I will also say that that is not sustainable for the district to continue doing that year after year. So we do have a couple things in place that we'll talk about later. Mercy does also have a transition of care plan. So employees who are currently in the process of receiving care. And for example, I will use, maybe a person having a baby. So they're due September 1st. They can fill out this transition of care plan, have the option to remain with their OB through the delivery of their child, and then at that time, they would transition back over to Mercy for their pediatrician and their follow-up care. So what they don't want to do is have somebody be in the middle of specialized treatment or something like that. They want this transition to be seamless. So we have 14 days to get that information to them after July 1st. And so that's when all that paperwork is due. As far as the benefits department, we reach out to all new Mercy enrollees once open enrollment has been concluded, and we send them that form right away. If you are in the middle of care, please know that this is, fill this out. And oftentimes we're either meeting with them or having a phone discussion of some sort with them. As I said earlier, we are anticipating a 14.5 renewal. So we did some quick analysis of what that would look like in real life. So an employee who is currently enrolled in a single plan will experience a $6.07 increase per paycheck. The district, for all of our single enrollees, will experience a $1,067 increase annually. For our families and enrollees, they will experience an $876 increase annually. The district will experience $3,214 annually as far as our 88% of that 14.5. So what is next? Like I said earlier, we know that 14.5 is not sustainable for the district. Last year, we did talk about going self-funded and what that would look like. In July, we transitioned brokers and have now partnered with USI. They kind of went and dug into some of the data, and they pulled that out, and they put it into a program for what it would look like if the district went self-funded, okay? This year, if we were self-funded, we would spend an additional $3.2 million, making that 15.4 up to 18.6, okay? If the previous 2 years we were self-funded, we would have spent an additional $7 million in costs. And if we continue to receive the same increases and everything remains the same, we will increase the district budget to over $30 million per year in the next 5 years. At this time, it is the recommendation that we remain fully insured, but we have to start looking at some things and some plan design changes. So what are we going to look at? We're going to look at our plan designs. What would an HRA or an HSA look like? What would it look like if we added back co-pays, co-insurance to the plan? We are adjusting where the risk is held when we do things like that. So there would be some sort of an increase in the cost of the full premium for the plan, but it's still worth looking to see how we can adjust that employee responsibility. We can look at tiered medical plans. Do we offer a health plan with a very high deductible and maybe a more expensive health plan with a lower deductible? We'll also look at the point of service plan. which is where employees can go outside of out of the network to see their doctors of care. One thing that I'm looking forward to is engaging with the Mercy leadership to increase our programming and wellness. So I'm looking at programs such as maybe doing some health risk assessments and maybe doing some HEDA scores with our employees. So for example, that would look like I'm a 40-year-old female, and so have I gotten all of the recommended testings and things done for my age and gender. Our focus during this renewal will remain to increasing the staff access for care. We have to improve that medical loss ratio, and we have to ensure the financial stability. So a couple things that we're going to do. We will implement programs that focus on prevention and chronic illness management. We cannot get away from those high claims such as car accidents, cancer, things like that. So we need to chip away at the middle, at the, perhaps some ailments that go untreated, okay? If we just want employees that if they have something that they are maintaining it. We want to execute an intentional approach for a wellness plan. Really want to look at making sure that our staff is as healthy as they can be for our kiddos. We implemented Healthiest You. That was a free virtual option that went live 1/1, and we'll talk about that in a little bit. And that is 100% free for staff, 24/7 access virtual care. My next big goal will, with the help of several people, looking down the road for a clinic. Like, I think that a clinic would really be able to expand that care for our staff and continue to chip away at that medical loss ratio. So I've been told I need some firm numbers, and so we're going to work on getting those. Our renewal timeline, the PPC meeting in April, we will have your renewal ready to go. And on the 14th, there will be a full presentation for the board. The 15th, I'll meet with the Benefits Advisory Committee and go over renewal with them. And then we will come back on the 28th for board approval. Any questions on that?
I have some comments. Thank you for all of this. It's a lot to take in. And, we all are not shocked about the dean removal from their decision to not work with us. We knew that was coming. We saw the numbers trending down as their rates increased substantially year after year. More of our employees moved over to Mercy or maybe chose the Family Advantage Health Plan if they were able to get insurance from a spouse that had insurance and was able to take that. So it's not new, it's unfortunate, it's not what we would have chosen. We wanted to remain a dual provider district. That was something that we really appreciated being able to offer to our staff. And unfortunately, we've had no control over that. It has become too expensive for our employees as well. So I just want us to make sure that we're reminded of that. It's not a surprise, but it's also not something that we are electing to do. And you were talking about this off-site clinic, and I want to point out this is not a new idea. A lot of districts are using this idea, and many actually in our surrounding districts have this.
Yes.
As like a co-op that some of the smaller districts have been able to partner together. And so we can take the information that other districts have gained and to our advantage and learn from what they've done. And they've been able to do some really great things. And for their employees, it's a win-win because not only is it an opportunity for employees to gain care much more easily and readily, but will help the employee save money, and then ultimately the district is save money as well. And, I know it's scary when people look ahead and see, oh my gosh, my insurance is gonna go up. the cost to us as a district, as we can see, it's going to go up substantially this next year, and we are just maintaining basically status quo, and we have no control over that. That is coming at us from, this is the industry that is presenting that, healthcare industry. And so basically, you know, I'm begging our lawmakers, I'm begging people out there, this is not sustainable for school districts to continue to go this route with this it's a funding crisis, not only for academics, but for health insurance. So we need help. We need people that are willing to figure out this funding nightmare and help us provide health insurance to our staff in a reasonable manner. So I just wanted to share that because I think these are all great, but there's a lot of underlying challenges that we're facing and will continue to face. Whether we want to deal with it or not, it's coming at us. So thank you for
Yes.
all the work putting this together for us. All right, well, we don't need to, oh, yeah.
We used to have multi-year do not exceed agreements in place. Has there been guidance from USI on how to maybe explore negotiating that?
So as of right now, we have not heard, so we received this not to exceed. We received it last year, and we received it if we were a sole provider, or if, excuse me, if Mercy was a sole provider, or if we were dual choice. I would say that while not to exceeds are nice, I also don't want to not have a regular increase too, because what I feel happened 10 years ago is we were under not to exceed, not to exceed, not to exceed. So we were not increasing our premiums at the rate that everybody else around us was. And all of a sudden, now we're getting hit with these huge increases to try and just get us back up to what other districts are at. So, and it's kind, we just have to balance that, right? Like, we just have to make sure that we're not getting ourselves into kind of the same situation. Okay. All right.
All right, we're moving on
Sorry.
to Healthiest You, right? Or
Yes,
no?
yes,
Yeah,
yep,
okay.
yes, okay. So as a reminder, Healthiest You went into effect on 1/1. This option was free to all active staff who are currently enrolled in our health insurance, their spouses, and all dependents, okay? 24/7 access to care. There is no limit on how many times they can schedule appointments, and there's a plethora of services, general meds, they can have nutritionists. Mental health was the big piece that really wanted me to get this program going, where they can see a mental health provider within 7 days. So, dermatology, that's another big doctor that's hard to get into. So, we've been live for 30 days. So I even tried to push them a little bit today to see if I could at least get a utilization date and see how many appointments we've had. We get them on a monthly basis, so unfortunately, I was not able to obtain a report. However, I was able to get some feedback from staff. And I have 2 comments and remarks that really kind of resonated with me. So the first one told me that it took, that their registration was super simple. They had called in over winter break to get in, and it took them longer to drive to the pharmacy to pick up their prescription than it did for them to have their appointment. So they were able to get in, see that doctor, and were on their way to pick up their prescription. The other person that I spoke with indicated that it was, again, ease of use. They were able to log right in, and they didn't have to pay for anything, and they went directly to the pharmacy, were able to pick up for their eye. So those 2 examples just help. I'm thinking of if they had to go to urgent care. Okay, if somebody goes to urgent care for their eye, they're waiting, right? Because if they're not blinded, they might be pushed down to wait for other people to be seen. But it's just within 30 minutes, that whole circle of care was done. Okay, they were able to get the prescription and have their appointment. So just the simple ease of that, I feel is a win, so.
think I might have asked this, but I'll say it again because it happens on multiple levels in variety of different workplaces. We hear it all the time here from you regarding this new implementation, but have principals like showcased it at principal meetings to their staff and train them on how easy it is to log in and walk them through that to gauge interest and more engagement? Because obviously, you've only had it for a month, so you don't
Yeah.
have those utilization. I just think that if I was a teacher and I was on the health insurance and I heard about Health ESU, probably don't have time because I'm writing for that sub who's gonna come in so I can do the Act 20, blah, blah. There are so many things in everybody's life that when great programs like this come in, it's hard for them to sit because they don't have 5 minutes to do that. But if 15 or 20 minutes could be carved out at a staff meeting to say, bring your laptops, let's walk through this, let's get everybody logged in, I want to show you how easy this is, then it's dedicated training for those health insurance. And if you're not on the health insurance, sit and just listen.
Yep.
I mean, I think unless you have dedicated time and space for certified, non-certified, everybody to do this, I just don't think you're gonna get the engagement that this should have because of those comments that resonated with you. If I could hear that as a teacher going, oh my gosh, it takes me longer to get my pharmacy meds than actually to do the appointment. Maybe that's something I should sit down and here, the district cares so much that they're gonna carve out 10, 15 minutes to actually walk me through it. I would be appreciative of that because otherwise I probably wouldn't find time to do that. That's my 2 cents.
Good, thank you for that feedback. We can have some conversations with our principals on that, absolutely.
How much does it cost us to have Health ESU?
Health ESU will be about $123,000 for the year.
And is that a calendar year?
Yes.
So that's, because we're a different
Yep.
we're a different fiscal year, so like January 1 to 12/31/2026, is that 123K?
Correct.
Okay.
I wanted to point out, USI, our broker, when they came on, they were able to find some cost-saving strategies that really helped us. And so then when we added Health ESU, it was cost neutral, right?
Cost neutral.
So it was not new to our budget, which was really, I mean, that's a great benefit for us and working with USI. When we were at the convention, a couple of weeks ago, the state education convention, I attended, one of the sessions. People were really talking about USI, and there were a number of districts with different healthcare opportunities, and there were, many of these districts were contracting with USI, and I felt like, boy, what very fortunate that we had switched over, because clearly there was a lot of success these other districts have made under their support. So I'm looking USI for even more benefits. Bring it on.
Yep, I'm with you.
All
Well,
right.
and just
any
if
questions?
if Health ESU can bring our MLR down, we're gonna save a whole lot more than $125,000.
Great point.
Yes, absolutely.
Thanks for sharing that. Okay, wonderful presentation, everyone. We appreciate you being here. Our next meeting will be the first Monday in March, and I don't know the date of that right now. This March 2nd. Oh, I think usually they line up, yeah, March 2nd, 4:30. We will have our agenda planning session next week, so if there's anything that you would like us to discuss at that, you always feel free to reach out. We do plan our agendas. Sometimes they're rolling for the next 2 or 3 months. We have some general ideas or things kind of set in stone because we have to plan things with different speakers and coordinate that way, but you know, it doesn't mean that we couldn't add things on. Dr. DeGraff?
Two things, we still have to approve the policy. And then, second, I just wanted to give you a clarification on your question about the private schools.
Oh, yes.
So, the piece that is a little bit different is it's the private schools that participate in the parental choice program. So if they participate in that, they're required to follow the Act 20 requirements, but also the second part of that was the same as what I discussed in the presentation. They have to use science-aligned reading instruction, but their assessments can be different. They don't have to follow the same state assessment we do. But, so I wanted to clarify, it's the private schools following the parental choice.
Interesting. Thank you. We did pass the policies, right? I didn't, yeah, we passed the policies.
We did?
Yeah, we
Okay,
did.
sorry.
They might have done it while you were walking.
Yeah, I think that's, don't worry, we did it. We did it, we did it.
It's a
We're good.
Monday. It's a Monday.
It was probably when I was looking at the parental
Probably,
choice.
probably, but it's good, we're covered. Okay, everyone, thank you so much, meeting adjourned.
I'll blame it on Chris, he just read it.